Yesterday, and therefore this morning, we reported 64 locally acquired COVID-19 cases, which we've reported today. 49 of these 64 are linked to known outbreaks. 15 cases having their acquisition source under investigation. 36 of the 64 cases were in isolation for their entirety of their infectious period. And this takes us to 701 active cases of coronavirus in Victoria at the moment, 697 locally acquired and 4 acquired overseas. 42 people are currently in hospital, 13 are in intensive care unit, and 8 of those 13 are on a ventilator. And we send our very best wishes to those fellow Victorians who are battling in a really serious sense the coronavirus. There were some 55,333 COVID-19 tests processed yesterday, a very strong day, right across the suburbs of Melbourne, but very importantly in Shepparton, Echuca and Bendigo. There was a lot of household engagement teams out in those communities as well, with 1,633 such visits, with 2/3 of those being in the Shepparton community. That's a record day for those household visits for both support and compliance, and very high levels of engagement there. In regards to vaccinations, Victorians continue to show that they are committed to getting vaccines into their arms as soon as they possibly can, and as soon as both the state-run clinics and the GP and pharmacy and other distribution points can get those vaccines into Victorians' arms. Yesterday there were 35,753 doses administered in our state-run clinics, bringing the state-run numbers to over 2.32 million doses. Every day, whether it's on social media or through messaging platforms or other measures, Victorians are proudly showing that when they are getting vaccinated, they are sharing that with their mates, their families and their broader community, because Victorians know that high rates of vaccination are the mechanisms via which we will get out of this pandemic, together with other public health measures. We've seen a really big demand over the past few days from Victorians aged 18 to 39, as they've really come forward to both our call centre and our online booking portal for state-run clinics, as well as approaching GPs and others in increasing numbers to make both their Pfizer bookings and their AstraZeneca bookings. And the thing that continues to hold us back in meeting those huge levels of demand is supply. Whilst we continue to see increasing levels of supply forecasted in coming weeks and months, what we really need is the supply to meet demand now. And we'll continue to ask the Commonwealth for more supply, because we know that with every dose of Pfizer, with every dose of AstraZeneca, that we will end up with more Victorians doing their part sooner to get us out of this pandemic. In regards to the actual outbreaks of COVID-19 across the state as well, we continue to see new wastewater detections. There's been another detection in the industrial estate in Sunshine West, and our testing teams from the department have been working very closely with the businesses in that precinct, getting lots of people tested, but there is still some undetected wastewater pings in that industrial estate. In recent days, there's been a lot of focus on emerging cases in the west and north of Melbourne, but it's not limited to the west and north of Melbourne. We have seen cases in the east and the southeast, including in local government areas of Manningham, Maroondah and Monash. And we've also seen positive wastewater detections in our southern suburbs. In particular, I want to call out the communities around Aspendale, Aspendale Gardens, Bond Beach, Carrum, Chelsea, Chelsea Heights, Edith Vale, Mordialloc, Patterson Lakes and Seaford. Across the dates from the 23rd to the 26th of August, we've seen in that wide southern catchment positive wastewater detections. So if you've displayed, even if you've been in those suburbs or in those suburbs and have displayed even the slightest symptoms of COVID-19, you need to come forward and get tested. There's plenty of testing centres right around the state and in those communities, and the turnaround time is very quick. We're well into the 90% for getting returns within the next day, and we need people to help us use the wastewater detection as the early warning signal to make sure that we stay ahead of the virus outbreaks. With the help of locals, we've also seen a substantial increase in the rate of testing in Shepparton and the surrounding communities. We had, on the back of the wastewater detection there, saw initial doubling of testing, which I'm sure played a part in helping us detect the cases circulating in that community. And that allowed us to mobilise the public health response as quickly as we possibly could, with the support of the fantastic Goulburn Valley Health and the local public health unit in that community, which saw the comprehensive response in that wider Goulburn Valley area. And that has led us to the position where there are currently 85 active cases in Shepparton, including amongst the numbers that we've reported today, 7 new cases from yesterday. Emergency Management Victoria is on the ground and supporting those local services and networks that have brought such a degree of support to the Shepparton and wider Goulburn Valley communities who are in isolation and doing their bit to run down this outbreak in that community. As I say, Goulburn Valley Health and the local public health unit are leading the charge there with their great work in contact tracing and testing, and we've seen the community respond to those testing calls in really solid numbers, with more than 20,000 tests being done in Shepparton this week. Rumballara, the local Aboriginal cooperative and health service, is working in partnership closely with Goulburn Valley Health, and they are working around the clock to keep their strong Indigenous community in the Goulburn Valley both engaged and safe. The Department of Families, Fairness and Housing, Regional Development Victoria, the Greater Shepparton Council, the Red Cross and a range of other civic partners are doing a great job in supporting that local community in the way they are to keep themselves isolated and safe as they get through these challenges. I want to particularly thank the Ethnic Communities Council of Victoria, Uniting, Primary Care Connect and the Salvos, all of whom are part of the civic organisations groups from right across the state and right across the Goulburn Valley who are getting together to get the Shepparton and wider community through these challenges. Whether it's through written material, bicultural workers, lots of online and other support work, WhatsApp, other messaging services, all of those groups are doing an outstanding job in connecting with and supporting their particular communities through the issues that the Shepparton community are dealing with. Emergency relief packages are being got out in record numbers and are available for people to continue to be supported through their self-isolation. Food, essential support, medicines, all the kind of things that people need are there, and the system has cranked up to record levels to make sure that the Goulburn Valley community get through these issues. Requests for any of these packages can be made by calling the coronavirus hotline on 1800 675 398 and pressing the option 4 to get you through to the right number. The Red Cross alone has been distributing hundreds of packages to support the community over recent days and will distribute hundreds more over the weekend as they respond to more demand. I might ask Jerome to go through the detail of the figures a bit more, and then we're happy to take questions. Thanks.
Thank you, Minister, and good morning. 64 new cases of coronavirus in the state today. That takes us to 701 active cases of COVID in Victoria. The Minister's gone through those in hospital, 42 Victorians in hospital, 13 of those are in ICU, 8 on ventilators. And in terms of the age profile, we have 60% of those in hospital are under the age of 30. 6% of all of our cases are under the age of 30. And 149 of our cases are under the age of 10. In terms of those that are in hospital, in ICU, in their 20s, we have 1 person. In their 40s, we have 8 people. In their 50s, we have 2 people. So again, a very young age profile for those in hospital. 26 of the 42 people who are in hospital are under the age of 50, and that includes 1 infant. We have 18,244 primary close contacts across all the outbreaks at the moment and 17,230 secondary close contacts. In terms of the 64 cases today, 7 of those are associated with the Shepparton, 10 are associated with our Broadmeadows cluster, 7 in the Carlton and Brunswick area, 1 associated with Altaqua College, and 1 case in the city of Dandenong. We have 9 further cases that are linked to cases we've identified in recent days, and we're still working on their linkages, but they are now connected. And we have 1 case under investigation. That takes us to 36 of the 64 cases today. An additional 21 cases are located in the western suburbs and linked to the western suburbs clusters, including 9 in Wyndham, 8 in the Newport and Altona North area, and 3 in the City of Hume area. And then finally, we have 7 cases in an area around Port Melbourne and St Kilda. That takes us to 64 for the day. 49 of those cases are clearly linked to established outbreaks and clusters. 15 of those cases remain under further investigation. We now have 41 cases in total under investigation at this point in time. 20 were cleared yesterday, so we continue to see good progress. So my thanks to our phenomenal contact tracing team and epidemiologists for the amazing work they're doing in giving shape to these outbreaks and giving us active lines of inquiry to work on. In terms of the major clusters that we're working on, Shepparton continues to be a very significant outbreak with 85 positive cases. That's an increase of 7 on yesterday. Over 9,000 primary close contacts and just great testing rates. 83% of those have now returned a negative test result. The one we now feel increasingly that Shepparton is starting to look like a very clear shape to Shepparton. We understand the linkages. It is all part of one significant cluster and a phenomenal response from the wider Shepparton and Goulburn Valley community. The new, one of the new little outbreaks around Shepparton has been the aged care facility at Echuca, Warfarilla, where there are 88 residents. I can confirm that there was a staff member who tested positive at that aged care facility, and that is a confirmed positive test result. She has since tested negative. So the positive test stands and the negative test stands. We also have tests of her household, which is connected into the Shepparton cluster through work and other reasons, well established and all legitimate. We believe that that household is coming to the end of its infectious period. We are doing serology work to establish fully the nature of those cases and what their timeline has been. We still have that infectious exposure at that particular aged care facility on the 20th of August. Testing was undertaken yesterday of all the residents and the staff. We still have around 40 staff on furlough at that location. It highlights again the importance of vaccination. This staff member was fully vaccinated, so we hope therefore to see very limited onward transmission, but the results will tell in the next day or two. I can confirm that 92% of the residents had at least a first dose vaccination and the vast majority had already completed their second dose vaccination, which is a very encouraging sign. Of the 182 staff, 56% had at least a first dose of vaccination. A vaccination team was on site yesterday to do some additional vaccinations, and I believe some of those were taken up. In terms of the Royal Melbourne Hospital cluster, that is no new cases today. That's now a total of 19. We continue to have 372 staff furloughed at the RMH. And again, my thanks to the whole team at RMH for the phenomenal work they're doing to keep our critical services going. The Broadmeadows cluster does continue to grow. There's 102 active cases now associated with originally the My Centre Childcare Centre at Broadmeadows. It's an increase of 10 on today. Over 1,000 primary close contacts. Almost 70% of those have returned a negative test result. And as I explained yesterday, we've seen it spread from the original staff and children at the Broadmeadows Centre and now go through wider households associated with the Broadmeadows Child Centre community. I met with some of the community who have children at the centre last night. Some very moving and some very honest stories around the challenges of young children picking up COVID and the implication on their wider families. And my thanks to the community groups who came together last night to share those stories and to share the lessons around how we better manage the risk of COVID spreading through our communities and through our families. At the Carlton Brunswick cluster, we now have 35 cases. Some of that is associated with earlier public housing outbreaks, and those cases are all safely accommodated in the hotel quarantine programme. We do have 3 of those 7 cases associated with the Coles at Berkeley Square. In Brunswick, we also have 4 further cases of those 7 that we're still working on the exact linkages at this point in time. So very keen to ensure we maintain that good grip on that Carlton Brunswick cluster and more work to be done on that over the next few days. The new cluster of some concern is around the Port Melbourne area. So we've talked many times in the last week around St Kilda and St Kilda East. We do have 2 more cases in St Kilda East, but they are primary close contacts. We're not too concerned about them. But in Port Melbourne, we have a cluster of 4 cases around the Woolworths at Fisherman's Bend and an auto mega warehouse, car wash, car dealership complex at 467 Plummer Street. There are a number of exposure dates and times that are going up online, but essentially between the 13th and 23rd of August, around that Woolies, we now see a cluster of those 4 cases between the Woolworths and the car dealership stroke detailing shop next door. If you've used those facilities in the last 10 days between the 13th and 23rd of August, please look out for those exposure sites details and come and get tested. We've not seen that crop up before, so we're very keen to make sure that that doesn't become anything else. And then again, we continue, of course, to work very closely with communities and leaders across the western suburbs. 162 cases in total, active cases in total across the western suburbs. That's an increase of 21 on yesterday. Again, very high testing rates, very high testing demand, and my thanks to everybody who is working so hard in those communities to support that testing effort and to support the work that so many thousands of people are doing in isolating safely and protecting all of us from the ongoing spread of COVID. In terms of testing, a record last 7 days, 354,000 tests, just over, completed in the last 7 days. 98% of those test results all back by the next day. Again, can I thank those over 350,000 Victorians for coming forward and getting tested over the last 7 days. That's how we're bringing the SHEP cluster under control. That's how the Royal Melbourne Hospital cluster is being firmly under control. And that's why we're making good progress with communities across the north and western suburbs and in those other areas of Melbourne that the Minister has referred to. Finally, briefly on vaccination, just an update, obviously a record day of vaccinations through our state clinics, but also a huge thanks and a shout out to the GPs and pharmacists that are also really now picking up the work on vaccination. Really good to see that over 50% of Victorians over the age of 60 have now had both doses of the vaccine, and we're seeing those numbers really starting to increase. And also over 43% of those Victorians between the ages of 40 and 60 have had both doses of the vaccine. So please, particularly those who have started the vaccination journey, make sure you book in your second dose that we're holding ready for you. And good to see the younger age groups, 37% of those in their 30s have now had their first dose, and 26% of those between 18 and 30 have had their first dose as well. We have 4 very large vaccination clinics, particularly in the west of our city, to really focus on those areas that are both younger but also less well serviced by the GP and primary care network. The showground site our showground site has over 1,000 vaccines a day that it's running through that very large facility. At Melton, we're doing over 800 vaccinations a day on average. At the Eagle Stadium in Werribee, we're doing over 600 vaccinations a day. And at Sunshine Hospital, we're doing over 1,700 vaccinations a day. There's also, of course, wonderful work being done by many GPs that we continue to support in the western suburbs. We are fantastic to see that every single vaccine dose that we're allocating out to our network, particularly Pfizer, is now being taken up with such enthusiasm. With that, I'll hand back to the Minister and we will take questions. Thank you.
Thanks, Jerome. Happy to take questions.
Are you paying GPs to bolster their clinics on weekends and after hours? Is that confirmed, or is that those negotiations still underway, the vaccine clinics?
So we know the medical benefits scheme is a Commonwealth responsibility, and both the distribution of vaccines to GPs and the payment of GPs has always been a Commonwealth responsibility. I know that the GPs have had some issues as to whether they believe that's adequate. In the hotspots, particularly in Altona North, where we've seen some real fantastic leadership by GPs, we're working with a couple of them to look at how we can demonstrate to the Commonwealth that there are better ways of supporting GPs to ramp up their efforts.
So exactly what does that mean?
Minister?
Well, Mukesh Harkwell, who'd be well known to a lot of you, former president of the AMA, has been able to demonstrate a model of delivery through a GP network, deeply engaged with community, to say we can do more if we get more. So over and above the allocation that he's received from the Commonwealth, we've provided extra vaccine supply to that service and a couple of others to demonstrate that the GPs, if they get more, can do more.
So we want extra supply
paying them, though, in terms of paying them for the weekends, the original question remains: is the state prepared to pay for the weekend work of GPs?
At what point does the Commonwealth stop outsourcing its responsibilities to the state? That's my question back. There's no question that the GP's payment system is a responsibility of the Commonwealth. In terms of a couple of model arrangements where we've provided extra vaccines, then with that comes extra costs. We are not paying GPs medical benefit schemes arrangements, but we are supporting those GPs in both the extra vaccines, both Pfizer and AstraZeneca, and the meeting some of the extra establishment costs that go with that. But we are not meeting medical benefits arrangements, because at what point do the Victorian government say to the Commonwealth government, you know, quarantining you've outsourced to us, responsibility and support for residential aged care, disability aged care, all of which were going to be done by Easter under the Commonwealth plan, we are still supporting because it's the right thing to do. Supporting GPs to demonstrate that they can do more is the right thing to do. But it all gets back to supply, and the state supply will deliver more as soon as we get it.
Are you calling on
GPs will deliver more as soon as they can get it. And we are demonstrating to the Commonwealth that the one thing that holds us back, particularly in the north and the west, where there is very strong demand, is supply.
So what do establishing costs mean?
Well, GP, if you look at the Altona North Respiratory Clinic, which is a Commonwealth respiratory support, Mukesh and his team have built up a deeply engaged model with their community that brings forward into the car park and into the wider surrounding area beyond the physical constraints of the building, more people, more facilities, physical facilities, and that brings with it costs, together with the need to exceed the amount of vaccines that he's allocated.
So to paying for the weekends, in other words, you want the federal government to pay for whatever overtime, whatever extra costs there are to get these clinics open on weekends so we can get more people injected.
That's a responsibility of the Commonwealth. It always has been and always should
and you'd
be.
like them to do that?
yes, we would. And if there's an issue between the GPs and the Commonwealth as to what that payment should be, I call upon the Commonwealth to resolve that.
Minister, you just said, just to backtrack slightly, you said that you'd give them additional supply if they could dish it out, and you'd also be looking at supporting them on those establishment costs to give them out on weekends. Would the effect of those establishment cost payments effectively be state subsidies to GPs to open for longer and do more vaccination? We know you can't pay the Medicare schedule.
We are demonstrating, because someone has to, that the GPs can do more when they have their systems backed up and supplied to extra levels. This is the distribution through the primary healthcare network is a Commonwealth responsibility. If we can demonstrate to the Commonwealth through a couple of model examples that they can do more, then I think that's a wise investment, particularly in those areas of the north and western suburbs where there is a disproportionate cases of COVID, and we need to do more in both responding to that and more vaccine. We think that's a wise investment, but clearly primary healthcare networks, GPs, pharmacists are the Commonwealth's responsibility.
Mukesh Hyperwell's also told me this morning that he feels the western suburbs are being victimised at the moment, really being singled out because of the high proportion of cases that are popping up there. What's your message to the western suburbs? And particularly, they copped the brunt of the second wave last year, yes, and we're seeing so many cases popping up in household groups and at workplaces there. What would be your message back to them?
So I've been asked this a few times, including yesterday, and the message is the same. The western suburbs, like the rest of the Victorian community, is at risk from COVID-19. The fact that this is a community that is younger on average, has larger families on average, has larger representation of permitted and authorised and essential workers, and has a lower rate of GP coverage in particular, has all come together in a way in which has seen, both in 2020 and again now in 2021, a higher rate of both COVID numbers and the need for greater vaccines in 2021. And we've responded in both cases in a partnership with that community to respond to those issues, and we'll continue to do so. The people of the West are fine people. They know that with the support of their community, the support of all levels of their government, that they will get on top of this.
Is there a meeting this afternoon with community leaders in the West?
There are so many meetings going on with community leaders from different cultural groups, different sporting groups, different levels of government, all around continuing the engagement of what an appropriate response to get the public health messages out, of getting tested, of staying isolated whilst your testing is being processed, of following the public health rules, of the benefits of vaccinations, whether it's in the western suburbs, the northern suburbs, the eastern suburbs, the southern suburbs, the Goulburn Valley, Echuca. These engagements are a key part of the public health messaging.
I just asked Jerome about the Port Melbourne cases that have come up. You said that it hasn't cropped up before,
Yep.
And we saw just before the press conference the car wash be listed over a number of days.
Yep.
Is there concern about transmission at that car wash, or can you talk us through more? What
Yeah,
concern
Simon,
is
if you, and I've not been on site yet myself, but if you look at that Plummer Street area, 467 Plummer Street, there's a car wash, there's a car detailing facility, there's some kind of car retail warehouse, and a Woolies right next door. What we've seen is 4 cases in today's numbers that have all got exposure at that particular location, a combination of the Woolies and a combination of the detailing shop. We are not yet certain whether there is transmission at that location, but when I've got 4 cases in one day in that bit of geography, obviously we're going to be a little bit concerned. So the call out today is to say if you're someone who's used that area in the last 10 days or so between the 23rd. The 13th and the 23rd of August in particular, then we'd really like you to get tested to make sure we haven't got anything else that's brewing in that spot.
Do you believe that's connected to St Kilda East?
No, I don't. I don't believe there's no connection there, Nick, to anything around St Kilda East. I've got a couple of other cases in St Kilda East today. We've been looking at, we've seen a number of isolated cases in the Port Melbourne area over the last couple of weeks. We had an architect's practice down the road from there that also we had some positive cases. That hasn't led to anything else, which is a very good sign. I'm pretty sure that if we all work together on these 4 new cases, we'll establish very quickly there's nothing else to worry about and we can get it under control. But it's a swift response, as we always try and do.
So there's no connection at this stage to the Port Melbourne is not connected to anything that you know about at the moment.
No, not exactly. So those 4 Port Melbourne cases in today's numbers are all new. There's no obvious linkages to anything else at this point in time. We have seen, a couple of weeks ago, we saw some linkages between an individual who lived in the Port Melbourne area, was active in Middle Park, was also active in St Kilda. So we did have some linkages between the original St Kilda clusters back into Port Melbourne. These 4 cases today we believe to be different. They're very much centred around that facility around Plummer Street. Hence, we're interested in getting people tested who've been in and out of that area.
Are we talking about staff members who have been in that area or people that are visiting? What's the sort of makeup
No,
there?
it's people. So it's customers of the Woolworths. It's people who've been using that facility. So not staff members at this point in time. Obviously, we'll start to work through their primary close contacts. We'll try to work out who else has been there. That may give us more information over the next day or 2.
Is it correct that that's in quite close proximity to like a transport hub, that people would be coming from interstate, things like that?
I wouldn't have thought so. Not particularly. Again, as I've said, I haven't been on site yet at that location, but there's no other obvious significant people movement linkages in that particular area.
I think there's a freight testing hub near there.
There is.
Is there any thought of opening that up?
No, not at this point, Simon. I mean, ultimately everything's next to something else in this city. So we have no reason to believe that the freight testing hubs at all associated with this. The 4 positive cases we've got, we understand why they were in that area, using the Woolworths, using that particular car facility. No other linkages to the other sites.
Are they linked to each other, or are we talking about 4 separate people?
There are some linkages between them. We're still getting to the bottom of those now.
So a couple of them have been to both facilities.
That's right. Yeah.
Are there issues here with people not getting tested when they were symptomatic, given the exposure goes back so far?
I don't have any information on that yet, Paul. As we know, there are some people that are coming through every day are asymptomatic, but they're still getting tested, which is good, or they're being picked up because we see a symptomatic case and then we work through their close contacts. I've got no concerns at this point in time between those 4 people, but again, the reason for bringing it to the table today is to say, here is a new small cluster of 4 cases popping up on one day in one bit of geography. There's a clear overlap point there. So at this point, let's be prudent and let's get as much testing done in that area as we can.
In regards to the aged care worker, you said it was or the minister said it was a positive and then a negative.
That's right.
Do we believe that was a false positive initially?
No. So we're very clear. So we're very clear that the first positive test was a genuine positive test with high CT values. We know the second test was negative. We're pretty confident with that. The exposure or the date of concern is the 20th of August, which was the last date that the individual worked. So that's what we're following through.
So does that mean she isn't infectious when that negative test came through?
That's right.
What prompted that?
That's right. So the 2 tests are about 2 days apart, 3 days apart. So from when she first took her test, which was the first positive test, and then when she took the subsequent follow-on test, I think that was 2 days later. So it's not unusual when somebody is at the end of their infectious period, that as their infectivity starts to reduce, that they're certainly positive at the first point of testing, they're no longer positive now. That's good news. It's good news for her and for her family that she's no longer positive. Obviously, we continue to want to understand, well, where did that acquisition come from? Yeah, we have a good correlation with Shepparton, but we're keen to understand through serology exactly how that all fits together.
How many in her household are positive?
There's nobody in her everybody in her household is now negative.
Is now negative. And the minister said as well that most of the residents in that facility are vaccinated.
Yep.
But the percent for staff was much lower. Why is that?
That's right. Well, look, this has been something we've obviously had concerns about for many months now. Aged care workforce has been eligible for priority vaccination for many months, and clearly, as a private aged care facility, it's ultimately under the oversight of the Commonwealth, and I know they're doing all they can to encourage testing, encourage vaccination uptake amongst aged care residents and staff. We've run a number of vaccination booster sessions through our state clinics, including now. So all aged care workforces, anybody who works in residential aged care, anybody who works in residential disability care can walk up to our vaccination clinics, the 55 or so that we have, and get vaccinated as a priority cohort. We continue to be concerned that we see relatively low uptake of vaccination in private aged care facilities, and we'll do all we can to support the Commonwealth in addressing that issue.
Is that
Is
a
it
massive
time-
failing? That's 56% first dose vaccination for staff. Is that a huge failing?
Oh, well, it's a huge concern. I mean, I think, again, as we know from bitter experience last year with what we saw happening in the second wave, we need our aged care facilities to be protected, and we need the staff in those facilities to be vaccinated. It's a huge cause of concern. I know the Commonwealth has commented on it a number of times. We're providing as much access as we can to our state clinics to get people vaccinated, but ultimately it's a matter for the aged care industry, so for the employers and for the staff. Get yourselves organised and please come forward and get vaccinated.
Is there a time to mandate it? Is it time to say you just have to have it done?
Oh, that's not a matter for me, that's a matter for the Commonwealth and others, Nick. My job is to run the vaccination system and the testing system.
Would it make, obviously, clearly, it would make your job and health authorities' job a lot easier if that was the case?
Yeah, look, I think there's conversations there. I think there's a matter for the Commonwealth in terms of how they want to oversee and manage the private aged care sector. Our view has been, and we have provided priority access to our vaccination clinics for months. So whilst we've held back many other Victorians who've had to hold back before they could become eligible for vaccination, all those younger people we saw rushing the gates this week to come forward and get those bookings made for Pfizer, we've held all them back for a long time in order to enable priority workforces to come through. That includes the aged care workforce. We've done again this week. We've opened up another blitz opportunity for them to come forward and get priority vaccinations. And I just implore, if you're working in aged care now, you can get a free pass to the front of the queue. You can go straight to the velvet rope and get in on the vaccination clinic, and we'd encourage you, please, to do so.
There's a lot of low-paid transient agency workers in childcare too,
Sure.
and there's lots of childcare. There's been childcare outbreaks recently. Are you seeing the same problems in terms of vaccination rates among childcare workers?
Look, I don't have data on every single work cohort pool in terms of who's getting vaccinated and who's not. I mean, the point of having the state-run system is to enable as many people as possible to get vaccinated within the supply that we have. So we'd absolutely encourage, now that everybody over the age of 16 is eligible to book a vaccination slot in Victoria, whether your age cohort is around Pfizer or whether your age cohort is AstraZeneca, please come forward and make those bookings. And as we get more supply, more slots will become available.
How are
still
you
saying-
handling on the availability front there? Because like
Yep.
today, for example, if you put in to try and get if you got your AstraZeneca shot today
Yep.
and you tried to book your second for 12 weeks' time,
Yep.
there's not an appointment at Sandown, Royal Exhibition Building, there's a couple at Jeff's Shed, nothing at the Austin. Why is that?
Oh, look, I think there is plenty of AstraZeneca available, and there is plenty of AstraZeneca available for those who still need to have their first dose. So there are still a significant number of people over the age of 60 who still need to book their first dose vaccination, and I would encourage them to now come forward and get that done. And similarly for second doses. So we have, from memory, around 100,000 or so AstraZeneca appointments open at the moment in the system between now and the end of September. So there's plenty of opportunities for those who need to get their first or second dose AZ in the next 5-6 weeks or so. We will open up more AstraZeneca slots for second doses as we get closer to the time, but you don't need to worry. If you're getting your AZ dose today, that's great. Thank you. Well done. We will ensure there is a second dose appointment for you in 3 months' time when that becomes due.
So it is sort of a stage thing, because if you look it up
Yeah.
today, it looks like there's nothing available.
Sure, look,
People shouldn't panic.
I applaud those people who are that organised that they book 3 months in advance for a second dose. I wish I could do that. But seriously, there is sufficient AstraZeneca available. There will be appointments made available that reflect the second doses that become due. Generally speaking, we book our vaccine doses or our vaccine appointments in line with the supply that we have and in line with the demand that we know that's there, particularly for second doses. And I think to date, everybody who's wanted a second dose on time has got it on time.
Jerome, are we still seeing a mild illness in children that have got COVID? And can you talk us through some of the stories that you heard from parents last night?
As I've said many times, I'm not a clinician, so there are others far better placed to advise on what the symptoms are and what people experience. And the session I was on last night included some local GPs from the community who were just fantastic in the way they explained the challenges of what COVID can do to children and to young people, and also the advice they gave to community members about what to do in their interest. But the stories I heard again last night, a young mother who described how her child had picked up COVID from the childcare centre through no fault of their own, and how rapidly it had spread through her household, and the implications and the discomfort and the discomfort and the real distress the child went through, but also the other members of the family went through. And she expressed very clearly, her fear as a mother for not only the child who was ill, but the rest of her family. And you're sitting there knowing that the likelihood is that COVID will run through your entire household. And that was it was a very moving and a very powerful story. And there are hundreds of stories like that. We have 701 active cases of COVID in our community at the moment. There are 701 stories of what this feels like and the concern and fear and worry that people go through.
Did she explain how badly affected her child and the other children in the family were when they were ill?
Yeah, she did. She described that, and I won't go into those details, Nick. But I think she described that very powerfully to the other members of the community that were in that conversation. And I think it was a salutary reminder, if we needed it, that said these are human stories. These aren't just the minister and I come up here every day and we talk about the numbers and the data and the stats, but these are all human stories. And I have friends who are living with COVID right now, and that is a difficult and challenging prospect for them as they see their children waiting for their children whether they're going to turn positive in the next week. Those are real human stories and real human concerns. And I appreciate that fortunately for the vast majority of us, COVID hasn't hit us personally, hasn't hit our household or our families, but for an increasing number of people it has. And it's something that nobody ever wants to get.
In that meeting, did anyone from My Centre Childcare say that they wish to have vaccinations mandated for childcare workers or prioritise some kind of priority?
Certainly no conversation around mandating, but absolutely every community conversation I'm part of, there's absolutely now a hunger for vaccination. I think we all now realise the importance of vaccination in getting out of this pandemic. So that comes up in every single discussion we have with people around how do people get access to vaccine, how do we get further eligibility, we're hearing a lot less of what are the pros and cons of different vaccines, or should I be vaccinated? The conversations are now around, can we get more vaccine, please, and can you make it easier for us to access? And they're all completely fair points.
Overnight, there was a heap of exposure sites that went up around kind of Geelong, that far kind of outer west area.
Yep.
A lot of them were fast food outlets, petrol stations, that kind of thing.
Yep.
Is this a case of like a food delivery driver, or is it just someone really hungry in the community?
This is it's not somebody who's very hungry. This is the positive case. I think we talked to yesterday in Geelong, and we've also been able to work with them and the household. I think he's in a household of 7 people. No other positive cases yet coming out of that household, which is really encouraging. But obviously they're all now in their normal isolation. The usual protocols around primary close contacts of contacts is taking place. And yes, a number of locations that were identified in the Geelong area that individual's frequented.
And Sunshine West, can you tell us in that industrial area approximately how many tests have you now done over the past week or 10 days? And it must be bamboozling because it keeps on popping up, doesn't it?
Yeah, it's an absolute Agatha Christie story at the moment, trying to detect where the virus is in that Sunshine West industrial precinct. So we have done repeated wastewater testing on a daily cycle over the last 2 or 3 weeks. 2 weeks, I think it's been pinging for about 10 days. We've now started the teams have done some very good detective work to try to narrow down to which corner of that industrial estate those tests relate to. We have done literally thousands of tests of people who are working on that site. It is a very large site. We've had good cooperation from Ozpost and all the big businesses that are on that site. We're continuing to work with some of the smaller businesses to try and track down exactly what's been going on here. So we've got teams in there that are dogs with bones at the moment, and they'll just keep worrying away at this until they get to the bottom of what that positive case is that's pinging in that location.
Those New South Wales truck drivers that we saw that came through Victoria, South Australia, and have ended up in Perth, do we have any exposure sites related to them here in Victoria?
No, not yet. So we're obviously working closely with our WA colleagues to try and establish as much about their movements as possible. And this has got a little bit echoes of 4 or 5 weeks ago with other interstate truck movements. So we're working with WA to see what movements they've made and where they were. And at this point in time, we've not identified any exposure sites.
And the definition of it at the moment. So I think you said the 20 cases from the western suburbs today, they were all linked to a geographic area. Are any of them unknown epidemiologically in terms of their acquisition? What's the breakdown of the mysteries today?
So the cases today, so we've got 64 cases today. 49 of those are very clearly linked, epidemiologically linked to another case. So our crack team of epidemiologists have worked out exactly is it a primary close contact? Is it exact that nature of transmission that we've talked about so often in these conferences? We've then got 15 cases where we don't have that epidemiological link. A number of those 15 cases are clearly associated by geography, by where they live, where they work, or where they socialise, where we're saying it is very likely that this is a common source of transmission with other cases who have a very similar pattern. So if I take the 4 cases in Port Melbourne as an example, those are all 4 cases who have been to the same facilities at roughly the same time. We don't yet have an epidemiological link that says we can see that Percy and Sarah and Bill all directly contacted each other and overlapped with each other at that time, but we know they all went to the same site. So we have regarded that as a linked cluster. We will now work through what that epidemiological connection really is.
How many of today's mysteries are in the western suburbs? Do you know?
Of the 15 cases that we've got today, I'd need to check. I think it's a fairly high proportion, probably about 3/4 of today's 15 as yet not epidemiologically linked cases are in the western suburbs, and that's a pattern we've seen over the last week where we're seeing, and again that's the nature of particularly that community transmission that we've seen. It's not surprising. Shepparton doesn't have that profile. Shepparton, we can see the connections very easily. It's like a ball that's pinging around, and you can see exactly where it's been. The western suburbs and the inner north, that community transmission piece, that one of the profiles of community transmission is that you get cases where they're all in the same geography, they're going to the same places, but it's coming from different sources. And that's the nature of our concern about the western suburbs. What's encouraging about that story over the last few days is that those numbers, although they're grumbling along at a fairly consistent level. So we haven't seen a big spike. We haven't seen a big amplification event. We're not seeing any big spreading events. That's really good. It's a good sign. What we're also seeing is just the most phenomenal reaction from a huge number of organisations and leaders and individuals in that part of our city, because we're all binding together and saying, how do we collectively stop this and deal with it?
What can we do? What needs to be done in those western suburbs?
Well, I think there's what we can do collectively across the state, which is around how do we continue, this compliance we need to have with our directions around social distancing, around mask wearing, and around isolating and staying home as much as we reasonably can, because we want to stop the spread of the virus. That's something that applies to all of us in the state, all 6 million plus of us. I think particularly where we see those areas where we see levels of community transmission, it's around how do we encourage people to get tested so that we can really start to uncover where there are cases we're not aware of yet, because if we don't know the cases are there, we can't stop the transmission. So encouraging people to get tested and having that level of confidence to get tested is really, really important, and that's where we're seeing just some great leadership from a whole heap of people.
Last year, I think in the north, we did testing vans in high-risk areas going into the suburbs. Are we considering doing anything, new interventions to really target that area? Yeah, look, I think if I look at today, we've got a pop-up testing site up in Newport. It's been run by one of our community group partners, and they've created a bit of energy around it. And that's all around encouraging people in that part of the city to come forward to get tested. And so we will continue to work with those kind of trusted community partnership organisations, because they can actually help us get the messaging out and create the right kind of environment that gives people confidence to come forward and get tested. And in the meantime, we're seeing 55,000 people a day get tested across the network. That's great. That's the way we will navigate our way through this. Get people tested, work out where the links are, support people to isolate and give them the confidence to come forward and do the right thing.
As that lockdown deadline nears, though, Victorians are obviously getting more and more desperate for this to be over. So
Sure.
In the new numbers that we're seeing, is there a gap? Are people, as you say, not getting tested fast enough? Are they not sticking to their isolation between getting tested and getting their result? Are they not isolating when they know they're COVID positive? Is there any patterns that we need to be calling out and stopping?
Yeah, I think I've described the patterns really over the last few days. So we can see again the cluster. We've got a series of clusters that are really well controlled and really well supported. And if I go back to Shepparton and the RMH, the work we did in St Kilda, we're seeing the people who are impacted, the people who are positive, the people who need to isolate, doing exactly that. And we're seeing a lot of support being provided by my team, by a whole heap of other people to support people to isolate and do the right thing. So those clusters, not surprisingly, are coming under control and are well controlled, and we're not seeing lots of leakages from those clusters. The community transmission areas, those 160 odd cases in our inner suburbs, are of more concern, because there are multiple different chains of transmission that are running around, and we're trying to make sure that all of those chains of transmission basically run out of steam and get controlled. We are seeing on the whole really good levels of testing. We're seeing on the whole really good compliance with isolation. Yesterday we visited 1,600 people in their homes to check on how they were going, make sure they had the right food relief, make sure they were isolating. And again, 99% of them had done exactly that. So we're not seeing huge problems. But what we do have, and particularly in those inner suburbs that I've talked about, is because you've got multiple chains of transmission, there's always a risk that there's something bleeding around somewhere that you haven't got control over. And that's the bit we're trying to nail down now.
It doesn't sound very optimistic, does it, for coming out next week?
Oh, look, I mean, I'm always an optimist, Nick, because I think if I look at the level of support we're getting and how we respond to this, if I look at the way that people on the ground are responding, 99 times out of 100, I'm confident that all Victorians want to get hold of this and want to get it under control so we can actually ease off the restrictions and get our lives back. We all want to do that. So, but we've got to put this fire out first. If from the point of view of running the response, I need to make sure that we've got control over those smouldering embers, and that it's not going to kick off another fire. That's the main job. It is too early for the Chief Health Officer and for the wider public health team to provide that advice around whether we've done that yet and what the appropriate settings are going forward.
When will they provide that advice, Jerome?
That's not for me to say.
What gives you
Simon.
comfort, though? You're obviously the man looking at the numbers day in and day out and,
Yep.
and the outbreaks. Is it no mystery cases? Are they the kind of biggest bugbear for you, or what is it? Having numbers under 40, like what's your kind of benchmark?
It's, as we've said many times before. I mean, Brett's commented on this, the minister's commented on this. It's about the numbers, but it's also the story behind the numbers, and particularly for us, the mystery cases piece is critical, because if we're seeing no mystery cases, that's really important. Secondly, it's those cases that are in quarantine, that are safely in quarantine. That's really important. Those are the two really important metrics for us to have a close eye on.
It has been 3 weeks of lockdown.
Yep.
We still haven't managed to get our new local COVID cases to single digits,
Yep.
or the amount of people infectious in the community to 0 digits. So surely lifting lockdown in a number of days is out of the question.
Look, it's not something for me to opine or to take a view on. What I will say, what we've achieved in 3 weeks, is the place hasn't exploded. We have seen a really strong, robust control over these outbreaks, and we've seen from other places around the world how quickly these things can gather steam. We've got literally thousands of people. We've got 20,000 people in isolation at the moment as primary close contacts. We've got another 15,000 secondary close contacts on top of that, and you've got thousands of healthcare workers doing everything they can to get this thing under control and to keep it on the deck. It's on the deck at the moment, but it's not fully under control, and that's the work we have to do over the days ahead.
So we're going to be in lockdown until majority of us are vaccinated?
No, and I think that everything we're striving to do in the response, in this whole collective, whole of state responses, if we can get this outbreak down, if we can get those mystery cases eradicated, if we can get everything into quarantine, that gives us options. That gives us options to ease restrictions, to do other things. That's a judgment call for Brett and for the public health team, but that's the options we're trying to create. So if we can achieve that, then we have an option to do things before we get to vaccination, because it's on all the projections we see now, based on a supply in the Commonwealth's vaccine supply network, it's November before we're all fully vaccinated. And we're not going to lie down now and say that's it, it's just too hard, we'll just wait for vaccinations to take care of this. We have to get this outbreak completely under control so we can get our lives back for the spring.
But is it likely that that's going to happen if things have been simmering away over the last 3 months, pretty steady now? No explosion, but we certainly haven't reduced it down.
Sure.
Is that likely that we're going to be out of lockdown anytime soon?
We are completely 100% committed to achieving that. That is what we're all. That's why we're working around the clock on, and that's why we're seeing hundreds and thousands of people out there striving to achieve that. So everybody who's holding a needle in a vaccination centre, everybody who's testing people in testing centres, and the hundreds of thousands of other people. That's what we're trying to do. We're trying to get this thing down and under control, and we need the help of the whole Victorian community to do that. Because if we keep seeing new clusters emerge, so the minister referred to the Sandbelt, Chelsea, Bond Beach, etc. If we're seeing cases suddenly emerge there, that's another 6-7 days of work to do what we've done in Shepparton. And we've demonstrated as in Victoria that collectively we can hold on to these outbreaks. So Shepparton, in the space of 7 days, has come well under control at a huge cost to the Shepparton community in doing so. That's what we're trying to stop, all these outbreaks popping up, get those under control and get that level of community transmission right down, because that gives us options for the coming months.
When you're looking at the landscape of all the cases, is there any, avenues for extra nuance or anything in terms of lockdowns, in terms of restrictions?
I'm completely focused on how do we respond to these outbreaks and how do we get them under control. There are signs there that we say, if I look at Shepparton, if I look at RMH, I look at the response around even things like Echuca, that's really encouraging. If I look at the community response we're seeing in our suburbs, that's really encouraging. But there is more work to do because we have 64 cases today and 15 of those are mystery cases. So there's a full board of work for us to work on. That's our absolute focus. Obviously, it's the role of others, particularly Brett and the public health team, to stand back off that and say, what does that mean in terms of our policy settings? We've still got 5-6 days of big work to do before the 2nd of September, and we won't stop until we get it done.
We have 10 mystery cases a day almost on average
Yeah.
in the north, in the south, in the west. Isn't it, given cases when they pop up, that's a lagging indicator of where it's actually spreading. Cases
Sure.
don't pop up until
Sure.
a week later. Isn't it almost certain that there are probably several more unknown chains of transmission that we'll see in the next week, 2 weeks, 3 weeks?
No, I think that's the you only get that if you continue to see people bridge directions. So if we're all doing the right thing, if 99 out of 100 of us are all doing the right things and complying with the directions, that's when you stop seeing those chains of transmission continue to grow. That's why the lockdown is there. And it's worked every single time we've had to do it. So whether we did it in February, when we did it in May, in June, in July, it's always stopped these outbreaks in their tracks. Now, Delta is much harder, and we know that this time round it's gone deeper because we've got higher levels of community transmission happening in some of our key suburbs. But I'm absolutely convinced that if we continue to see the response we're seeing on the ground, that we have an opportunity to run this to ground. That's what we're trying to do.
Minister, can we ask you, please, are you negotiating with the federal government for 120,000 extra doses a week, and how are you going if you are?
Well, supply is a responsibility of the Commonwealth. Negotiating might be too fine a word for it. We've said to the Commonwealth, you get us supply and we'll distribute it.
So you're pleading with them for, and the figure
Well, we
of
get up here
120...
every day. We get up here every day and say, as soon as the supply is with us, we'll get it out the door. Well, for instance, yesterday, the Commonwealth, and we're very pleased, through the ATAGI process indicated vaccine will become available for 12 to 16-year-olds. And that's great, but there was nothing about extra supply. We've got General Fruin's document, which has been honoured, but we don't have any undertakings from the Commonwealth about extra supply, even though we could very much use extra supply. We could use it, our GPs could use it, our community pharmacists could use it, our community health centres could use it. Victorians want to get vaccinated. As we demonstrated with the 450,000 bookings that went online on Wednesday, I'm pretty sure they're just about all gone. We've held back the second doses because we need to, and what we want is more supply.
And is 120,000, is that
I don't
an
know where
accurate
the
figure?
120,000 figure has come from. We would use everything and anything that the Commonwealth provides us. We got the 175,000 extra from the so-called Polish Pfizer. New South Wales got 500,000, I think. We need to make sure that Victoria gets its fair share of whatever it is that the Commonwealth procure.
Has that been a problem for you, Minister, when you're making these representations to the Commonwealth? A lot of it does seem to be going over the border to New South Wales.
We don't begrudge New South Wales its vaccines that they allocated. I think they've hit another 1,000 cases today. I see that in recent days they have skyrocketed past Victoria's total number of cases over the course of the pandemic. Their levels of hospitalisation and ICU is very challenging, and we want to make sure that the commitment that has been made to all Australians to get vaccines into anyone that wants it is done as soon as possible. And if there's extra vaccines to be had, Victoria will want its fair share.
Is it fair that if weeks go on and we remain in lockdown, which could well be the case here, and we really needed to ramp up vaccinations to get out, is it fair that New South Wales continues to get by far the lion's share when we are in the same situation restrictions-wise and require the vaccinations to ease those restrictions just as much as they do?
Well, I'm not here to comment on the New South Wales position and outbreak. other than to point to that's what happens when things get away from you. And the way in which things don't get away from you is that you apply the public health measures and you vaccinate, and you vaccinate and vaccinate and vaccinate. Victoria has demonstrated through our public health network and our more than 55 state-run centres the highest level proportionately of any state to distribute vaccines through that process. Our GPs are stepping up in increasing numbers. Our community pharmacies are increasingly online. Our community health centres, as Jerome indicated, whether it's pop-up clinics in particular areas with particular communities. After this, I'm off to see the Greek Orthodox community who have set up a pop-up vaccine clinic in the northern suburbs. There are so many opportunities. The only thing that holds us back is supply. And if the Commonwealth's got more supply, or if they're talking to others about more supply, the sooner they share that with us is the sooner we will get that out to Victorians.
Getting away from New South Wales, Jerome talked about us not giving up. They're now allowing weddings as of, I think, next week. They're allowing outdoor gatherings as of next month. They're talking about opening up at 70. I'm not saying that's letting it rip, and I'm not necessarily saying they're contradicting the Doherty model, but they have no interest in bringing case numbers down. Where does that leave the country? Is that the right approach for Victoria?
Well, whether you're in Western Australia, South Australia or Queensland or Tasmania with no cases, that's a pretty valuable thing to protect. Whether you're in the ACT or Victoria with cases that you, through hard work, can get back to that kind of level, that's a pretty good thing to aspire to. I can't speak for New South Wales, but what I can say is as the Minister for Health, I can see a comparative system under huge strain in their hospital networks, and we want to make sure that we take measures that protect our healthcare system, and thousands of cases a day, hundreds of cases in hospital, soon I suspect hundreds of cases to be in ICU, and with it about on average 5 intensive care highly specialised nursing staff and support staff for every patient. That is a huge demand on healthcare, and I would not be putting the Victorian healthcare system under that amount of pressure, because all of those cases mean your car accidents, your stroke victims, your heart attacks, your chronic illnesses are not in intensive care because those beds are taken up by others. What is at stake here is not just weddings and social events, it's life and death decisions to keep our health system operating at a level that Victorians would want to achieve. And that's at the heart, one of the issues that's at the heart of our public health response.
Can I just go on that one? Sorry, Nick. The National Cabinet Hospital readiness conversation yesterday. Do you know what that entails?
I understand the Commonwealth Government's put out a communique. Those conversations are ongoing. The Health Ministers' Forum meets regularly, and all the states, regardless of political colour, are joined in their calls to make sure that all levels of government contribute to maintaining and building the capacity of our public health system. I do note with great interest the reference that the Prime Minister uses to the Doherty plan being a safe plan. What all the states are calling upon is for the Prime Minister to demonstrate the resources and the commitment through money, through investment and support to demonstrate to us all that it is capable of delivering the safe plan, which we are confident it will, but we want to see the support from the Commonwealth to make sure that they uphold their part of supporting our public health system.
On kids' mental health, Minister, there were some pretty startling figures in the papers today. Obviously, that is a major concern. Mental health is one of your portfolios, but also what consideration will you take when you talk about lifting restrictions the mental health, particularly of our children, particularly now you have these figures, just how bad it is?
We know that the pandemic has had a big impact on everyone's mental health and wellbeing, but particularly young people. That's why running into the pandemic, an already stretched system was the subject of Australia's first Royal Commission into our mental health system, and the billions of dollars of investment that has already begun to rebuild it. And if it was needed before the pandemic, it is definitely needed during and after the pandemic. In response to the particular matters that were in the media today, as the Chief Psychiatrist rightly pointed out, he and other experts in this area feed their contribution into the public health team and the framing of their orders as to what public health measures need to take into account, including the mental health and wellbeing of young people. And as the Chief Psychiatrist pointed out in his public comments, that includes the measures that are to be avoided through those tough public health measures to make sure that we keep the supports in place, that the record amount of investment in clearing the backlog of support for Headspace, the record amount of support for teachers, for mental health support through schools, the support for Kids Helpline, Beyond Blue, Lifeline, the community-based mental health support systems, the acute hospital-based mental health systems, the eating disorder groups, the multitude of organisations that are out there at the mental health front line to make sure that our young people in particular are supported. All of that goes into the mix because I'm pretty certain that if we face the alternative New South Wales of even greater COVID running through our community, and with it the illness and the impact of that the mental health impacts would be even more significant.
Given that we've been in lockdown for 3 weeks and we haven't managed to drive this outbreak to the ground, is the benefit of this hard lockdown still outweighing the risks that it's presenting to young people and their mental health?
It's tough out there. Everyone recognises how tough it is. Everyone is heartily sick of this global pandemic. We know how tough it is. What we need to do is to redouble our resolve to follow the public health rules, to drive down these infection rates and to drive up our vaccination rates. And the mix of those measures and everything that sits behind those drives, I'm sure, all Victorians, the Victorian government, to make sure that we achieve that outcome. It's tough, but we will get there, because we have to get there to come out on the other side of this pandemic.
Is selling that message becoming increasingly harder though? Because as Paul just mentioned, we're basically under the same restrictions as Sydney. The numbers are incredibly different and they're showing signs of hope, people being able to go out, get married, people being able to meet outside.
I'm not sure 1,000 cases a day is a sign of hope. I'm not sure hospital systems with hundreds and hundreds of people in acutely unwell conditions in a hospital system that is getting increasingly stretched despite the protestations of federal ministers who would not frankly know what the situation of delivering a single service in a hospital is. I'm pretty sure that if you ask those intensive care nurses in Sydney hospitals at the moment how they saw the situation, it wouldn't be a hugely rosy picture. We are not going to put our health system in that level of stress and strain because that means people get sick, and the sort of stories that you heard Jerome reflect on families about what it means to real people become not a couple of hundred, but a couple of hundred over 3 weeks, but become a couple of thousand every day.
My question...
This is not a situation that Victorians would want to be in, and as tough as it is, we want to continue to support Victorians to get through to the other side of this, and we will.
My question though, Minister, is does it make it harder for you to keep selling that message to Victorians when the messaging is so incredibly different across the border? They're talking about don't look at the case numbers, look at the vaccination rate instead. Is it making it harder to get Victorians to understand that your approach is clearly very different to what's happening in New South Wales?
Well, I can't speak for New South Wales. I'm pretty sure that if they had their time again, they might well have gone harder and earlier at the start of their outbreak. That's not for me to comment, other than none of us get the chance to revisit history. What we've got is a chance, a very good chance, of keeping our numbers of infections down to manageable levels, if not all the way down to the levels that we know will allow us to change our settings. If that's then supported by high levels of vaccinations, that gives us that prospect of hope. That gives us that prospect of coming out the other side of this as soon as possible. If coming out the other side of this is with thousands of cases of people every day and hundreds of people going into our healthcare system really unwell and smashing our healthcare system, I'm pretty sure that's not an optimistic picture that the people of any state want to be in.
If that's our approach, should Victorians give up any hope that lockdown's going to lift
Of
this
course
coming Thursday?
not.
This coming Thursday, that's still a possibility.
We'll have more to say about what public health measures need to be in place once the public health team have provided that advice. I think it's realistic to say that there will be public health measures in place until such time as we come out the other side of this in one shape or form, as there has been for 18 months now. The shape of those, how they relate to the vaccine program, that is a matter for the public health team and the position that they will bring to government. And that is based on hope. That is based on the aspiration that Victorians know that following the rules, the public health measures, is the quickest way to get those infection rates down, and getting vaccinated is the quickest way to get our protection levels up so we can reopen. That's the sense of hope that the two sides of the one coin will get us out of this pandemic as soon as we possibly can.
On another issue, Minister, are you concerned that teachers are now talking about industrial action and what effect that will have on children who are already suffering?
I'm not particularly well briefed on the status of the enterprise bargaining agreement with teachers. Our teachers have done a great job over the course of the pandemic. The figures that were just released on NAPLAN earlier this week demonstrate not just teachers but families and students have all contributed mightily to better outcomes in our schools in the toughest of circumstances. And I'm confident that constructive discussions will continue between the state and the education unions to make sure that those matters are resolved. Everyone happy? Thanks, everyone.
Sorry, was that?
Yeah, that was the reference.